Hi, this is Congressman Charles Rangel. This week in Washington, we were blessed with a very unusual but very timely visit by a delegation of black religious leaders from across the country. They came to advocate on behalf of the fight against HIV/AIDS, but their presence was like an unexpected thunderbolt as they used the occasion to raise their voices in support of the passage of national health care reform at the very moment that the debate on the president's top initiative was at its peak. They made it abundantly clear that the universal availability of health care insurance would be a vital step in both preventing and treating AIDS. AIDS has been a silent killer in our communities for the past 30 years, affecting our brothers, our sisters, neighbors, and friends, as well as millions of people around the world. The lack of insurance has only made matters worse for its victims. This epidemic doesn't discriminate by religion, race, gender, or creed. In this country alone, 1 million people are living with the disease and over 500 million have died. But in the U.S., blacks and Hispanics are by far the most likely victims. The black clergy men and women took a dramatic step to fight against a disease that in some cities is reaching epidemic proportion. More than 60 strong, they brought a powerful message of support of a bill to focus attention on the prevention and the treatment of AIDS in the black community. The bill which I introduce is called the National Black Clergy for the Elimination of AIDS Act, H.R. 1964. It would expand programs in education, prevention, testing, and treatment, especially in the African American community. And it would make recommendations to the president for a more targeted approach in fighting this dreadful disease. The black clergy has been on the forefront of every struggle in our community, from the breaking of the shackles of slavery to obtaining the right to vote. But not since the civil rights movement of the 1960s have the clergy been so organized and mobilized for a fight, working in partnership with the Congressional Black Caucus, the Black Doctors, and other national institutions. Many have played such an important role in this legislation, and I wish I could name them all. But I really want to especially thank Reverend Dr. Calvin Butts of New York. He's the chairman of the National Black Leadership Commission on AIDS. C. Virginia Fields is the commissioner's president, and Debbie Howes Frazier is the founder of this great organization. And we have dozens of ministers who convene together in Washington. A full list of these participants in that remarkable program is on my website, wrangel.house.gov.